Now, from the News Channel 5 network, this is Medical Mondays.
Well, hello and welcome into Medical Monday. I'm Chuck Long, going to be here with you for the next hour. Looking really forward to the show this evening. We are going to be talking about common foot problems. We all have them. So many different ones to talk about, so many discussions that we can have on them. And as always, this is your forum. We love to hear from you. And the number that you call, as always, is 615-737-7587 here on Medical Monday. As we talk about common foot problems, we are talking with Dr. Carrie Gannon. Great to see you, Dr. Gannon.
Hi, thanks for having me.
Oh, it's, you know, and as we were talking before the show, I started just listing all the things that I've had to deal with. I mean, you know, whether it's plantar fasciitis, you know, there's ingrown toenails, so many things.
Sure.
Kind of tell me, in general, what do you see the most common foot problems seem to be?
You know, right now, a lot of heel pain, plantar fasciitis, ingrown toenails, diabetes. We see diabetics all day, every day. Diabetic neuropathy, toenail fungus, warts, bunions, hammer toes. Right now, people are out mowing their yards. I've seen a lot of people amputate some toes, mowing their yards barefoot. So that's kind of what we see a lot of right now.
I see. And there are so many ways, though, that these can be prevented or that these can be treated, and that's what we want to talk about. Once again, that number is 737-7587. We want to hear from you. Maybe you have a particular problem. Maybe it's a friend or a family member. But all you have to do is give us a call, get in on the conversation. And the thing that I always like when we're having these conversations on air is the fact that you may be listening to someone else who has that problem and you're thinking, oh, I can relate to that, or someone else does. And this is some great advice that I can use to help those problems. And I was telling Dr. Gannon as we started the show, one of the things, and I had never had this until about 2 years ago, but I couldn't figure out where this pain was coming from on the bottom of my foot. And I work out every day, and I thought, have I done something, you know, to the muscle or something?
Sure.
And then realized after talking with enough people that it was plantar fasciitis. So is that fairly common with people?
Plantar fasciitis is one of the most common problems with the foot. I see it daily. It seems that anyone can get this. Active people, inactive people, it doesn't really seem to matter. You know, plantar fasciitis is not a muscular problem. It's actually inflammation of a ligament that attaches to the heel bone. And it's kind of tricky because you might feel better a little bit, and then you step up on it again and it'll hurt you quickly, and then it feels better again. And people think, oh, this is going to get better. And over time it doesn't, and it builds and it gets much worse. So yes, we see it very frequently.
Well, and there are a number of ways that you can treat it or that you can help it. And like one of the things that I did is I had that tennis ball, and I would sit there watching television and I'm just rolling, you know, my foot on top of that tennis ball, and that really seemed to help. What are some other ways that you can help plantar fasciitis?
Well, tennis ball typically isn't curative. You know, what we're always looking for is supporting the ligament more adequately with rigid soled shoes, rigid inserts for your shoes. Stretching exercises are frequently very helpful. Then we talk about controlling the inflammatory process so that it doesn't recur. A lot of times we'll do that with oral anti-inflammatory medications. Injection therapy can be very helpful. Taping, immobilization, ice. Ice is very good for this. People try to heat it and it actually creates more problems. So also icing.
And when you, how long do you use the ice on
Usually about 20 minutes for every hour, and then you take it off, you can do it again.
Okay, so that's good to know. And you know, the thing that I was telling you, and I was glad because when I first came up with it, I thought, oh no, am I going to have to deal with this, you know, for the rest of my life? But actually, it's gotten much better. I haven't had a problem with it in a while, so I was glad to know that. Now, we were also talking heel pain and plantar fasciitis, kind of all related there.
They're one and the same. I think it's kind of a garbage basket term that people use. Plantar fasciitis, heel pain, heel spur syndrome, heel spurs, all of those things people tend to use to describe the one thing, which is just plantar fasciitis. And the important thing about plantar fasciitis is there's no cure for it. What we do is we get you better, and then we teach you the way to maintain it so it doesn't keep coming back, so you're not continually suffering from it.
Well, and one of the other things that I realized that I was doing that summer was I was wearing those very, very flat flip-flops. So, and that's not a good thing to do.
No-no.
That's a no-no. What kind of shoes should you have?
The more rigid, the more firm the shoe, the better. Obviously, shoes that fit adequately. I see that a lot. People don't wear adequately sized shoes. But the more rigid, the more firm, and a shoe with a slight heel. The more flat the shoe, the more likely you are going to get plantar fasciitis.
Now, when you say fit adequately, is that to fit, you know, exact, or should you get it a little larger? Should you leave the shoes tightly tied, loosely tied? What's the key there?
We really need to have a more large accommodating shoe. You should always have about a thumb's width at the end of the shoe to accommodate the various shapes of the bones and muscles of your foot. If they're on too tightly, you will create problems. You'll create nail damage, ingrown toenails, damage to the skin, plantar fasciitis. So really a larger, more accommodating shoe is better.
Now, another thing that I did, and it seemed to help, and as I looked for advice, and that's why I love the fact that we're doing the show this evening, is because this is your place where you can get some great advice, questions, comments. Again, we welcome those when you call in. But when I was exercising, they said stretch out kind of, you know, where you're stretching your calf muscle and that sort of thing, and that seemed to help. So I did that on a daily basis, morning and night. Was that good? Those
are all things that can help you manage plantar fasciitis, the stretching, the icing, and the shoe gear. If you do those at home on a regular basis, hopefully you don't have to come see me quite so much. But if it occurs again, you know, come in and see us, and we'll give you a little tune-up and get you back to managing it appropriately with the stretching.
Now, I also want to mention, when you say come in and see us, where can folks come in and see you?
So we're located in Franklin and Spring Hill. So we serve Nashville, Brentwood, and Franklin and Spring Hill, but our two prime locations are in Franklin and Spring Hill.
And you kind of split your time in between?
I do. I'm 50-50 at each location.
Okay, well that is good to know. Right now, though, we are going to head to the phones. Carla's on the line with us. Carla, good evening. Do you have a question or a comment for Dr. Gannon?
I do. I have two short questions.
Sure.
The first one has to do with some pain in my toes and my left foot, and it's just kind of like on the tips of the bottoms of the toes. It's bearable. I've almost kind of gotten used to it, and I'm not diabetic. I have an appointment with my primary care, so we'll be able to examine it. Second is with regard to my nails. I've noticed as I've gotten older that they kind of disappear from the sides, if that makes any sense.
So nail changes over time, particularly as we age, are not uncommon. Frequently they'll change shape, they'll change color, they will become thicker. A lot of times, particularly if shoe gear has been too small, they will thicken and look dystrophic or damaged. And then also nail fungus. You know, we see a lot of nail fungus, and what happens with that is a lot of times our immune system kind of becomes lazy as we age, and it will stop fighting off the fungus that is present on our bodies, and the fungus kind of gains an advantage underneath the toenail and can thicken. But nails that are pulling back a little bit and changing shape, that's fairly typical. You know, nails are constantly changing just like we are, so I'm not super concerned about that. I would say with the toe pain without diabetes, if it occurs worse in shoe gear, it may likely be more from a functional perspective, or the mechanics that you're wearing. Sometimes you can get a pinched nerve that will create the sensation changes in the toes, or even hammer toes or bent toes that are creating the pressure and pain, and all of those are easily treatable.
Okay, good to know. Carla, thanks for calling in this evening. We appreciate it. All right, we are going back to our lines right now. A lot of you calling in. That number is on your screen. 737-7587 is the number to call. Have any questions about common foot problems? A lot of us do deal with this, so get your calls in now. We're going to go back to the lines, though, as we said. Rosalie is on one. Good evening, Rosalie. Do you have a question or a comment for Dr. Gannon?
Yes, I have a foot problem. My right foot is larger than my left foot. I think they did an ultrasound and found out that there was a problem with the leg muscles of the right leg being larger too. And seemed to be an infection, so I was prescribed an antibiotic, which did help with the redness a little bit.
So it's not uncommon to have shoes that feet that are asymmetrically sized. Most people that come in, their feet are two different sized, usually by a half size or a full size. What you're describing, though, sounds a little bit more like you may have had a mild infection that possibly caused what we would call cellulitis, maybe the redness and the swelling of the leg and the foot, which would have increased the size of your foot, particularly during that time. You know, a lot of times when we have the swelling and the edema, we recommend compression socks. Actually, we recommend compression socks really for everyone. Just below the knee, it'll help keep that under control, hopefully keep some of that redness and cellulitis that you get. And again, with the shoe sizes, you probably need to size your shoes up for the larger foot.
Okay. All right. Well, Rosalie, we appreciate your call. We hope you have a good evening. So thanks for joining us. We are talking Medical Monday. We are talking on Medical Monday common foot problems. We are going to take a break. Get your calls in, questions, comments. We do welcome those. There's your number right there on the screen. We'll take a break and we'll be back after this. You're watching Medical Monday.